We're back at the annual meeting of Women's Cancer, Society of Gynecologic Oncologists, and we're going to speak to an expert about laparoscopic surgery. So I'll have her introduce herself, and we'll talk a little bit about laparoscopic surgery.
Sure. My name is Kathleen Moore. I'm a physician, a GYN oncologist at the University of Oklahoma Stevenson Cancer Center in Oklahoma City, Oklahoma.
Laparoscopic surgery is a part of minimally invasive surgeries and has a pretty long history. Can you explain a little bit how long that's been around and how long it's been being used in gynecologic cancers and surgeries?
Yeah, laparoscopic surgery has been around for longer than I've been a physician. In GYN, not so much cancers, that's more in the last decade, but in gynecologic surgery, certainly it's been around for multiple decades. And in fact, gynecologic surgeons are the ones who really introduced the concept of minimally invasive laparoscopic surgery to the field of gynecologic surgery and mastered it. It's been taken over, of course, by general surgery and urology, and everyone else has adopted it because it is, in many cases, a superior surgical modality. But really the first people that developed this were the gynecologists, and then really in the last, I would say decade to decade and a half, it's been fully integrated into a lot of what we do in GYN oncology.
What are some of the specific cases that it is used and then specific cases that's not used in GYN oncology?
I mean, it's hard to make absolute statements like that, truthfully. I think we have real universal agreement that for patients with endometrial cancers felt to be early stage, which most are, that a laparoscopic approach is a superior approach from a patient recovery standpoint, not from a disease standpoint, but from a patient comfort, patient recovery standpoint, a laparoscopic approach with either a total laparoscopic hysterectomy or a laparoscopic assisted vaginal hysterectomy, and then the ability to do laparoscopic nodes and staging. That's been studied in a very large randomized phase 3 trial, and disease outcomes were the same. So you're not getting a lesser cancer surgery, but patients recovered easier, had kind of higher quality of life scores, were back up and around quicker than with an abdominal incision. And that's the benefit of minimally invasive surgery. It's not a better cancer surgery necessarily. For some, in some hands it may be, but it's better for patients in terms of recovery.
And as you look toward the future, what do you believe some of the things might come? Are there surgical things that are happening with laparoscopic surgery or minimally invasive surgery that you're excited about?
I think there's a lot of exciting things that are happening in minimally invasive surgery in terms of helpful tools to make the surgery perhaps easier for more practitioners to embrace. I think this is where robotics comes into play. I think robotic surgery is basically laparoscopic surgery using a very big tool, the robot, and it allows surgeons in some part, who weren't trained in laparoscopy to do laparoscopic surgery safely. It's an easier way to do laparoscopic surgery. And in some cases, it allows surgeons to do things that they would have liked to have done laparoscopically, who are good laparoscopic surgeons, to still do it minimally invasive, in a minimally invasive fashion. But the robot, allows them to do some technically more difficult things. So there are, those sorts of advantages, but it's still laparoscopic surgery. And so if you've been trained in laparoscopic surgery, it doesn't add all that much. If you weren't, or you're doing very complicated procedures, it is a helpful thing. There's also single site laparoscopic surgery where instead of, with my cases, a patient's going to end up with an incision in her belly button and then 1 or 2 to 3 5-millimeter port sites. So not very many, but still, 4 total port sites. Single sites, one incision in the belly button, no other port sites. So it just sort of escalates patient recovery even more. So that's sort of another new tool that's coming around, but still all under that rubric of minimally invasive laparoscopic surgery. So it's more kind of utilization of different tools than it is a real different procedure.
Thank you very much, Dr. Moore.